Serving all of San Diego, this is your Fox 5 News.
Coming up, finding the perfect nose that fits your face. We're talking to an expert next. Yeah.
All right, the nose job is one of the most common cosmetic procedures, but there isn't always a positive outcome. A new study finds that more than 80% of women who've had nose surgery want a redo. Dr. Vincent Marin of Marin Aesthetics is here to explain how to get it right the first time. Good morning to you, doctor.
Good morning.
All right, first of all, let's talk about why are so many folks, you think, unhappy with the outcome of their nose job?
I think the nose is a very complicated area to operate, and most notably because it's right in the middle of your face. It's something that everyone's going to see. As surgeons, we term this as it's a surgery of millimeters, meaning that a millimeter can make a difference in a good or bad nose job. So it's something that when we look at this, it's very detailed surgery, and so we want to make sure that any little thing that could be seen on the outside is corrected, and so patients will come back if this doesn't happen unhappy with the shape. And then one other issue with the nose is that it also functions just as much as it adds to your appearance, and so there's a combination of factors that makes the nose very unique when we operate on it.
So you have a kind of a cool demonstration here where you can show on the screen sort of the before and the after. So we're going to show an example here, right?
Yeah, this is when I have a patient come to me, we kind of like to allow patients to kind of quote try on their nose and see if it's something that I understand what they want also, and that they're going to like the changes that we can potentially do. But what we try to do is that if you get a girl like this where she's got a little bit of a bump on the nose, we can kind of just push down that bump as it moves and start to kind of make that disappear. Now as you can see, we can still throw that nose out of balance just by moving the bump back, but we can actually kind of shorten that up and kind of push it around, and then as we go through, you can give her a shot to say, hey, are you going to like this nose? Is it something that can we make more or less changes? So something simple like that where we can see a patient go back and forth and they can get a chance to, try it on and see if they're going to like it.
That's so interesting, and I bet a lot of times they think they want something really drastic, and then when they see the picture like this, they say, wait a sec.
It's very true. You get a lot of patients. I have patients that may even do this at home. Patients will learn how to do it on the internet. They'll come in and say, listen, I've already morphed my nose. This is what I want, but one of the important things about nasal surgery is the nose has to be in balance with the rest of your face. A patient has a larger nose, says, we're going to really fix this and make it very small, and what happens is that small nose doesn't fit the rest of their features, their eyes, lips, and just the shape, the skeletal shape of their face. So what happens is sometimes they come in with ones that's just too drastically changed. So this is something that I think is a great tool.
Absolutely. I bet a lot of folks come in too and say, okay, I want this celebrity's nose, and it might not fit their face.
Absolutely, and although the nose may be a nice nose, it's very hard to kind of start with what they have and achieve that. So the best and the happiest patients are ones that when we do this, they understand kind of where we're going with the surgery, and so we're on the same page, and they can be realistic about it. Because one of the other issues that leads to unhappiness is patients coming in thinking they're going to have one kind of results, and then as a result of natural phenomenon or just their anatomy, we can't get it there, and then they're unhappy. So part of this successful outcome is communication.
And it's not all cosmetic either. A lot of folks probably want to come in after having had an accident or something sort of traumatic. I think we have a picture to put up of that.
Yeah, we get a lot of patients that will have a nose they're very happy with, and as you go through, you start to look at some of the issues that'll come as a result. It's deviated or crushed, or they have certain patients, and a lot of what happens is they can't breathe. So like we said before, it's one of those that what we're trying to do when to get a successful rhinoplasty is create something that not only looks good but also functions well. So that's something that will push patients absolutely in our door regularly.
And I understand you all are seeing more and more men coming in. You think of this as being a sort of a female issue, but not necessarily.
Yeah, it's one of the top 5 operations for men for many years. It's very common. We see a lot of men coming through the office, and it's one of those things is that it is pretty gender non-specific. Both men and female see this equally, and it's more based on your own genetics. So we have patients, and especially as we're evolving, men are more and more concerned with how they look and making small changes like that. And men often you'll see more trauma from sports action or activities and things like that. So it does play into this where it works out, but a lot of happy men as well. So yeah, we're seeing a lot more men in all different areas of cosmetic surgery.
Excellent.
Yeah.
Doctor, thank you so much for joining us this morning. We really appreciate it.
Thanks
and for more information on Dr. Marin, you simply go to our website, fox5sandiego.com. Click on the See None button. Raul, back to you.
Erica, good information. Thanks a lot.